Welcome, curious minds, to the deep dive. Today we're plunging into something, well, incredibly relevant to so many lives: joint health.
It really is.
And what's surprising, as our sources reveal, is just how widespread this issue has become. I mean, it's not just for older adults anymore or, elite athletes.
Not at all.
We're seeing significant joint and ligament issues popping up in young adults, people in their mid-20s to mid-30s. And it doesn't seem to matter if they're athletic or not.
That's a really key observation.
Yeah, and the millions of views on videos discussing joint health online just underscore how acutely this resonates with you right now.
Absolutely. And our mission today really is to unpack the systemic factors in our modern lifestyle that are contributing to these widespread musculoskeletal problems.
Right.
This isn't about simple wear and tear, not always. It's about understanding the deeper why behind this pervasive trend. So we're going to explore physical habits, the insidious role of stress, diet, and even some surprising aspects of modern medicine, all to give you a concise understanding and hopefully empowerment over your joint health.
So here's the question then. If former pro athletes who've pushed their bodies their whole lives and people who've maybe never played sports beyond a casual game, if they're both facing similar joint challenges, what are the common threads? What's going on in our modern lifestyle that explains this? Let's dive in.
Okay.
Let's start maybe by contrasting physical well-being across generations. Our sources, they paint quite a vivid picture of past generations, spending loads of time outdoors, actively playing,
Yeah.
forming what's described as a colossal health reserve, a huge health safety market. It feels, well, very different from today for many.
It truly is a fundamental shift, a shift in human movement patterns. This transition from, unstructured outdoor play to increasing digital engagement. It isn't just about less activity.
Right, it's the type of activity.
Exactly. It's a profound change in the type. That unstructured play built coordination, joint stability through diverse natural movements.
Makes sense.
Screen time, on the other hand, it promotes static postures, limited repetitive movements. So you end up with a generation that has a sort of deficit in fundamental physical development.
A deficit. Wow.
Yeah, making them far more susceptible to injuries, chronic pain, even from just moderate loads later in life. It's really the absence of those varied natural movements that historically built robust musculoskeletal systems. That's the key issue here.
And what's alarming is seeing these problems show up so early, especially when we know, as the sources point out, that joint recovery rates decline significantly after age 35. It feels like it could be setting up a potential public health crisis, where many people enter that phase of reduced healing capacity already dealing with pre-existing conditions.
Precisely. This generational decline in overall physical endurance, it's like a collective undermining of the body's own self-healing capacity, its endurance. A systemic weakening, really, driven by these modern lifestyle factors.
A systemic weakening.
Yeah.
That sounds like a ticking time bomb. Especially, like you said, considering how crucial age is in the body's ability to repair itself.
Absolutely. Take joint recovery. The rate it happens slows down significantly after 35.
Significantly?
Oh, yeah. A 20-year-old recovers almost instantly from those little micro-traumas. But for someone older, similar incidents can easily lead to chronic inflammation, lasting damage. That's a big reason why professional athletes often retire from really demanding sports after 35. Their bodies just can't bounce back the same way.
Okay.
So ignoring these age-specific activity levels, especially pushing too hard after 45 or 50, is a major cause of joint damage.
Yeah, I recall an expert mentioning a personal story about a hand injury. It needed a really long rest period. And the point was rushing back just leads to re-injury, even longer recovery. Patience is just essential.
Paramount. Absolutely. That story really drives home the danger of pushing too hard too soon. Our bodies have limits, and those limits change over time.
Yeah, they really do.
And when we look at specific high-intensity sports, some definitely carry greater risks. Karate, for example, apparently leads in hip and knee injuries. All those powerful kicks, extreme stretches.
Okay, that makes sense.
And yoga, maybe surprisingly for some, ranks second for hip injuries and meniscus tears,
Right.
often from improper stretching techniques.
Really?
Yoga, yeah.
And this can be compounded by what our sources call the hypermobility trap.
Hypermobility trap, what's that?
Well, hypermobility itself is a genetic condition.
Mhm.
Some experts even call it a disease. It allows joints to bend way beyond the normal range.
Okay.
So people without this genetic predisposition who try to achieve that kind of extreme flexibility like doing the splits or a full lotus pose, they risk serious injury.
I see. The problem comes when instructors who happen to be naturally hypermobile push others beyond their natural physiological limits. It fosters this sort of toxic fitness culture that values these aesthetic achievements over functional, sustainable health.
That makes so much sense. We see these amazing flexible poses online and think, oh, I should be able to do that.
Exactly. And then you have weightlifting.
Yeah.
Now, it can be beneficial, done correctly and age appropriately.
Related.
But it poses significant risks, colossal pressure on ligaments and joints, especially for folks over 40. You really need to know what you're doing.
So it's not just the intense stuff. It's often the subtle daily habits that are really shaping our joint health, right?
Oh, a huge factor. The pervasive impact of a sedentary lifestyle and screen time, it's undeniable.
Less time outdoors.
Significantly less time outdoors for many, especially younger generations. More time kind of stuck on social media, computers, tablets, and this directly contributes to joint problems, reduced physical endurance.
And posture.
Oh, definitely. Poor posture from sitting for hours, that sort of sunken shoulders look. It inevitably leads to musculoskeletal issues. Back pain, neck pain, you name it.
I remember an expert talking about his own journey with posture. He was first told, like, strengthen your chest muscles.
Okay, common advice.
But it made things worse. It was only when he started strengthening his back muscles that his posture actually corrected.
Exactly. It underscores how important correct anatomical understanding is, not just following, common wisdom.
Which can sometimes be wrong.
Precisely. It highlights how much misinformation is floating around. And beyond physical habits, you've got nutrition and environmental factors playing a role too.
Like what?
Well, our modern diet, often heavy in ultra-processed foods, artificial additives, chemistry, as one source put it, environmental toxins, coupled with maybe long-term reliance on certain medications,
Right.
that can directly contribute to systemic inflammation and joint pain. It might not be the primary factor for everyone, but for some, definitely. And specific genetic predispositions like gout.
Yes. Gout.
Combine that with certain dietary preferences, excessive beer, vodka, red meat, and you can directly provoke joint inflammation.
That brings up another common belief. Swimming. Everyone says swimming is great for back problems.
Yeah, but here's the nuance. Only proper swimming technique helps.
Okay.
If you're just kind of thrashing around, maybe holding your head up awkwardly, you could actually make things worse.
Yeah.
It just shows how superficial understanding can be really misleading. True benefit comes from understanding basic biomechanics. Otherwise, these seemingly healthy activities might be ineffective or even harmful.
So the message for you, the listener, is really question that general health advice. Seek out nuanced expertise. Don't just follow a trend.
Understand the why behind it, absolutely.
Okay, let's shift gears a bit. What about something many might not immediately connect to joint health? Stress.
Stress. It's absolutely scientific, as one expert put it. It has clear physiological consequences. Your body reacts like it's under attack.
Fight or flight.
Exactly. It releases hormones like cortisol. These cause blood vessels to constrict, blood sugar and pressure go up, muscles tense, preparing for action.
But the action never comes, usually.
That's the critical part. If these hormones aren't discharged through physical activity or maybe emotional release, they stay elevated, that leads to chronic physiological changes. The body's ancient stress response, built for short bursts, now traps us in this constant emergency mode. There's no natural release valve.
So the body's just perpetually revved up, ready for a threat that isn't really there in the same way. How does this chronic readiness specifically hit our joints beyond just muscle tension?
Okay, this is crucial. Chronic stress actually thickens your synovial fluid.
The joint lubricant.
Exactly. It becomes more viscous, less effective. Think of it like trying to run an engine on, like sluggish, thick oil. It increases wear and tear. Stress can also raise cholesterol, thicken the blood. Again, the body's sort of preparing for potential injury, which historically might mean bleeding. Our sources estimate that over 50%, maybe more, of health problems in modern urban dwellers are psychosomatic, stemming from the mind.
Over half. That's huge.
Oh.
So if that many health issues might stem from psychological factors, treatments just focusing on physical symptoms could be completely missing the root cause.
Leading to that frustrating cycle of medication, temporary relief, but incomplete healing.
Yeah, that's a really significant insight for anyone listening. Okay, let's talk about something many of us do rely on. Medication. What are the hidden impacts on our joints?
It's pretty eye-opening when you look into it. Many common medications, particularly those prescribed for, say, blood pressure, They actually list joint pain, arthralgia, arthritis, or even the development of conditions like gout as potential side effects, right there in the instructions.
No kidding.
And these triple action drugs, the ones combining multiple medicines in one pill, they only heighten those risks because each component can have its own adverse effects.
So you could be taking something for one problem, and it's actually causing your joint pain.
Exactly. Continuing those drugs while trying to treat the joint problems is completely counterproductive. You're fighting a fire while pouring gasoline on it, essentially.
Wow.
And other side effects can pop up too: muscle breakdown, muscle damage, muscle pain from commonly prescribed cholesterol-lowering drugs, for instance.
This really points to a systemic issue, doesn't it? Where treating one condition can unintentionally cause or worsen others, especially these musculoskeletal problems, like a cascade effect.
Precisely. And our sources critique the modern medical approach of sometimes immediately prescribing multiple drugs without thoroughly investigating the root cause first.
A shift away from diagnostics.
There's a concern noted about a shift from a deep diagnostic scientific approach, maybe more common in the past, to a more, let's say, commercial or pharmaceutically oriented model. This can lead to overprescription, a lack of focus on underlying issues, and of course, a strong caution here against self-medicating. Especially antibiotics for viruses, totally ineffective, and they really mess up your gut microbiota.
Okay, important warning. Now, supplements. Huge market. Are they helping us? Harming us? What's the deal with joints?
Well, for people who are physically active, a high-quality glucosamine, chondroitin, collagen, these can be beneficial for joint health.
High quality being the key words there.
Absolutely. Because, and this is the big caveat, the market is just flooded with potentially dangerous low-quality supplements. You have to be careful.
You get even trickier, right? Like too much of a good thing.
Exactly. Excessive consumption of certain vitamins like vitamin D or minerals like calcium, it can lead to serious problems, like kidney stones, for example, or something called chondrocalcinosis, actual calcium deposits in the joints.
Ouch.
And prolonged high doses of vitamin D can cause things like nausea, joint pain, muscle pain, the very things you might be trying to fix.
So what's the advice then?
Our sources generally advise against long-term continuous use of vitamin D and calcium, maybe a maximum of 1 to 2 months, especially during winter when sun exposure is low.
Okay.
And they also raise a point about analyses, like routine vitamin D level checks. Sometimes these might be driven more by commercial interests than true medical necessity.
Like a cycle.
Potentially, yeah, a cycle of perhaps unnecessary testing leading to over-supplementation.
Right. Given all these complexities, medications, supplements, potential misdiagnosis,
Right.
how can you, the listener, ensure you're getting the right diagnosis and treatment?
Well, the expert strongly emphasizes that medicine is a mathematical science. Accurate diagnosis is absolutely fundamental.
But incorrect diagnoses happen.
Unfortunately, yes, they seem to be common according to our sources. For instance, many diagnoses of arthrosis might be wrong. The real issue could be chemical exposure, medication side effects, maybe even that vitamin D overdose we just talked about. Similarly, disc herniations, often overdiagnosed as the sole cause of back pain. Minor bulges are actually pretty normal as we age. Severe pain is more likely coming from muscle spasms or maybe vertebral displacement.
Okay.
Even something called a hemangioma, basically a common harmless birthmark in the bone, is sometimes misrepresented as a dangerous tumor, causing a lot of unnecessary fear.
So relying too heavily on scans like MRI without a really thorough clinical assessment that can lead us down the wrong path.
Directly to misdiagnosis and inadequate treatment, yes. The expert stresses that diagnosis must begin with a detailed patient history, maybe some lab tests, before you even get to the imaging stage.
Okay, what about hands-on treatments? Manual therapy, massage?
Crucial best practices here. First, proper history taking and lab tests are paramount. Things like C-reactive protein for general inflammation, uric acid for gout, CCP antibodies for rheumatoid arthritis.
Why is that so important?
Because doing manual therapy on an actively inflamed joint like in arthritis could actually make the condition significantly worse. You need to rule that out first.
Got it. Image after assessment.
Exactly. And as for massage, it should always be gentle, relaxing, pain-free. The goal is to relax muscles, not traumatize them. One expert even shared a story about getting injured from an overly aggressive Thai massage.
Oof. Gentle is key.
Gentle is key for manual therapy, too. Rough manipulations carry serious risks. very serious. There was even a tragic example cited of a manual therapist causing fatal internal damage.
Oh, my goodness.
And here's something crucial, often overlooked. After manual therapy, it's critical to take mild anti-inflammatory drugs for 2 to 3 days
Right.
to prevent post-procedure inflammation and stop the problem from flaring up worse than before. Our expert notes that many familiar manual therapists don't know this.
Wow, that's quite an omission. If such a vital step isn't widely known or practiced, that really points to a gap in knowledge or training, doesn't it?
It's deeply concerning, especially when you consider, practitioners who might lack formal medical education, maybe learn techniques informally, the risks increase.
Okay, we've unpacked a lot of problems. Let's talk solutions. What are the actionable strategies for you listening to maintain joint health long term?
Right, let's get practical. Exercise approaches need to adapt with age. For young people, say up to 35,
Yeah.
they can engage in almost any physical activity, within reason, of course. Joint recovery is fast. The absolute key is ensuring full healing of any injuries before jumping back in. Don't rush it.
Okay, up to 35. What about middle age, 35 to 45?
This is where greater caution comes in. Joint recovery speed is significantly reduced. It's probably time to transition away from highly competitive, high-impact sports. Those little micro-traumas can now easily lead to chronic inflammation.
And older adults, 45, 50 plus.
Exercise needs to be done wisely. Avoid overloads that can quickly destroy joints, and attempts at extreme flexibility trying for the splits if your body isn't physiologically adapted, that's especially dangerous at this stage.
So the takeaway is,
The universal principle is simple. Every age has its own games. Physical activity is essential at any age. Inactivity makes the body rust, as they say, but it has to be appropriate.
so is there any type of activity that is universally beneficial?
Our expert highly recommends his own program of slow and smooth exercises.
Slow and smooth. Tell me more.
It's a type of gymnastics that focuses on improving blood flow to the joints. This promotes synovial fluid production and accelerates the body's own self-repair mechanisms.
And it works for all ages.
Yes, effective for all ages, although younger people might find it less exciting, perhaps. It focuses on gentle flexibility, static exercises, strengthening the body without aggressive movements.
How can you, the listener, recognize those warning signs? When does joint discomfort cross the line into needing attention?
Okay, key indicators. Chronic, persistent pain that doesn't go away. Significant limitation of joint mobility, like you really struggle to bend your knees fully or lift your leg out to the side, or even bend down to tie your shoelaces. And limping or feeling pain with basically every step, those are clear signals. Time to get it checked out professionally.
And what are the common mistakes people make that you should avoid?
The biggest ones we see are, number one, not allowing enough time for injuries to fully heal. That just leads straight to chronic inflammation.
Patience again.
Patience again. And number two, trying to jump back into past high-intensity activities after a long break, thinking you can pick up where you left off. The body loses adaptation. You have to build back up gradually.
Right, that makes sense.
Yeah.
Okay, let's loop back to stress. We know it's bad, thickens the joint fluid. What are practical ways to actually manage it for better joint health, better well-being overall?
Yeah, we need a multifaceted approach here. Firstly, physical activity is key for discharge. Sports, walks, especially long walks. One expert mentioned doing 30-kilometer walks for stress relief. Swimming, too.
30 kilometers.
Wow.
Okay.
Secondly, engaging in what he called gambling sports games, meaning competitive sports like tennis, soccer, table tennis, hockey, where you play with maximum intensity and passion. It helps release those pent-up emotions.
Interesting, like really letting it all out on the court.
Exactly. Thirdly, collective emotional release. Attending events like concerts or sports matches, participating in the crowd's energy, shouting, cheering. It can be a powerful way to let off steam.
Okay.
And finally, verbalizing emotions. Find someone to talk to. Or even, the source suggests, talking to an inanimate object, a stuffed animal, the mirror. Just getting it out helps process and release stress. People who hold it all in, they tend to suffer more.
That really highlights that effective stress management isn't just one thing. It needs both that physical discharge and the emotional processing. It's not just go for a run or talk to a friend. It's maybe both and more.
It's a comprehensive strategy, and it's also about developing mental resilience over time. Consciously re-educating your psyche, as the expert puts it.
Re-educating your psyche.
Yeah. Emotions that felt manageable at 20 can feel overwhelming, even destructive later in life, just due to their intensity or how we react. So learning to take things easier, consciously changing your internal reaction to stressors. That's key.
Hmm.
And of course, a supportive family environment, open communication, that significantly lowers stress levels too.
Your insights on emotional release,
Mm-hmm.
especially verbalizing, it reminds me of something you mentioned earlier. Tell us about your grandmother's approach to health.
Ah, yes. It's a powerful lesson, I think. My grandmother lived to 102. Her approach. She verbalized emotions constantly. She didn't hold anything in. She lived relaxed, didn't follow strict medical advice obsessively. She certainly wasn't analyzing her vitamin levels.
Oh, well, good.
And it really suggests that maybe emotional expression, social connection, not holding things in, that might be just as, if not more, important for longevity and well-being than obsessing over strict physical or dietary regimes.
A truly powerful lesson in holistic health. So bringing it all together, how does all this inform your approach when navigating the healthcare system today? What's the advice for our listeners?
Well, it really reaffirms that. Given how difficult it can be to find truly competent, holistic medical specialists, you have to take an active role. You must independently study health matters that concern you.
Become your own advocate.
Exactly. Self-education allows patients like you to ask informed questions, to critically evaluate diagnoses and treatment plans. It's why I actively create educational content videos, books to empower people to think correctly, as I put it, about their health.
Right.
And a serious warning here. Be extremely cautious about using AI tools like those chat models for medical diagnoses. They can provide absolute heresy, as one source said, really harmful advice based on flawed or incomplete internet data. It's a huge risk. Don't do it.
Yeah, that's a critical modern warning. So this really shifts the dynamic, doesn't it? From a sort of paternalistic, doctor knows best model to a more collaborative one, where you are an active, informed participant in your own healthcare journey.
Precisely. I advocate strongly for a holistic approach. Integrating physical activity, mental well-being, informed medical decisions, all these components, the physical activity, the mental work, the walks, the specific gymnastics, they all play a role in maintaining my own health. And remembering that medicine, at its core, should be a mathematical science where logical, evidence-based reasoning prevails.
So for you listening, it means cultivating a sustainable lifestyle, one that constantly adapts to your changing physiological and psychological needs, integrating all these different elements into your own personalized, evolving health strategy.
Yep.
What a truly deep dive into joint health today. We've covered so much ground, from the surprising issues in young adults to the huge, often overlooked role of stress and that critical need for informed patient engagement.
To just reiterate the core message, maintaining musculoskeletal health, especially in our modern urban environment, it demands a holistic and proactive approach. That means age-appropriate physical activity, always mindful recovery, effective stress management using diverse channels, and critical informed interaction with medical interventions and supplements. And remember, those slow and smooth gymnastics, a fantastic foundation for joint health at absolutely any age.
And I have to say, the expert's philosophy you shared, live brightly, live with pleasure, enjoy this life, that really resonates. It underscores that health isn't just about not being sick. It's a state of well-being that allows you to truly enjoy and participate fully in life.
Absolutely. And perhaps the most important skill for your future health. Learning to disconnect from screens more often, engaging in physical activity, even if it's just light exercise. It's about returning to those fundamental human movement patterns.
Disconnect and move. Simple, but maybe profound. So let's leave our listeners with this final provocative thought to mull over. If our modern world, with its screens and stresses, is inadvertently causing this widespread decline in foundational physical development and ramping up chronic stress, could it be that integrating some ancient wisdom, simple natural movement, genuine emotional release into our daily lives might actually be the most radical yet simplest prescription for our long-term health?